Okay, so the first part of the overall assessment is when you walk in, you're going to look at the patient, you're going to see their general appearance, you're going to note their age, their height, and their weight, if they're having any issues. First, you're going to do the head, eyes, ears, nose, and throat. So you're going to feel, first you're going to look at the patient's head, and then you're going to feel around on their skull for any lumps, bumps, bruises. You're going to look in the hair to make sure that there's no hair loss and everything's growing correctly. You're going to look at facial features, expression to make sure those are appropriate. And then you will move on with the eyes. So you would use a Snellen chart for vision. We don't have one of those, but first you would have them stand 20 feet away. You would have them read the smallest letter with both eyes. Then you would cover one eye, have them read the smallest, uncover, let it focus, and then do the other one, and then that would help. And then you wouldn't see what they all are together, all three of those, and that would test your cranial nerve number 2. And then for the pupils and all of that, you're going to, you could just follow my finger, keep your head straight. Perfect. And if you could just focus on my finger right here, and then you could look at a far off distance. Okay, look over at the TV. Okay, and then back. So pupils are equal, round, reactive, accommodating to light, which is cranial nerves 3 and 4. And then it's going to shine a light right here. Pupils do constrict. Perfect. Thank you. Then we're going to move on to the ears. You would actually look at the ears in the front and then the back, and then you would also look on the front and the back here. No deformities, no abnormalities. You would take your otoscope, and you would actually, to look in, you would pull up on the ear and look down in there. You want to see, make sure that you see the cone of reflex, that the tympanic membrane is not ruptured. You're going to see that it is gray. Note any extra buildup of wax and anything like that. And then, can you tell me, can you hear that? Rub your fingers together. She's able to hear on both sides. That test cranial nerve 8. Tympanic membrane, like I said, is going to be gray and no perforation. So you would have a tuning fork, and then you would actually test the Weber test. You would hit it, you would place it on the top of the head, and then you would ask them if they are able to hear it equally in both ears. And then with the Rhine test, or the Rene, you would take it and hit it, place it on the back of the ear right here, and then you would have them to tell you when they no longer hear it, and then you would place it here on the front, and it should be double from what they heard, and you would do that on both sides. And then for the lymph nodes, you're going to feel all around here in the back. You're going to feel down in the front. Sometimes they're going to be ticklish. You're going to do right here.
Okay.
You need to feel down in here, here, you know, into the hairline and things like that. You'll notice if there's any hard nodules, you know, if they're swollen, or, you know, if they're movable. And while you're up here, you can have your shrug your shoulders up. Don't let me push them down. Okay. And that's equal, and that is cranial nerve 11. And then trachea right here, it looks like it is midline. So if you could, you would stand behind the patient or to the side, and you would hold her here and have them swallow. Okay, can you feel that? I don't feel any quarters present or anything. And then you can displace the trachea a little bit and feel, you know, behind it. That is, yeah. And then you can have them to stick their tongue out, move it from side to side. Perfect. That's cranial nerve 12. And then while you're here, you can have them raise their eyebrows, close their eyes. You can lower your eyebrows down, open your eyes, about your cheeks. All right. Can you feel me touching? You can open up your cheeks. Feel me touching right here?
Yeah.
Feel me touching right here?
Mhm.
Okay. You can also check for sinuses. Is any of this tender?
No.
Tender right here?
No.
Okay. So all of those cranial nerves are intact. And then you would take a look at the nose. You would also take the otoscope. You would look up inside the nose to check for the septum to make sure it's not deviated. You want to be careful not to touch the end of the otoscope into the nose as well. Also to check the cranial nerves of the face, which is you're going to push right here and then have them to clench your jaw. Okay, clench your jaw again. Okay, that's intact. And then we also went over the other cranial nerves with the light touch on the face. The throat, when you look into the mouth, you're going to look and put your head up just a little bit. You're going to look and say ah.
Ah.
You can see the hard and the soft palate move. Tonsils do not look swollen or inflamed. They're able to stick their tongue out. They have all of their teeth. No exudate. Everything is okay on that. And then we move to, oh, one thing you can check is you can take your tongue blade. You can check the gag reflex. Nobody's ever super proud of this. Open it up, stick your tongue out, and then you stick your in there and make sure they have a gag reflex intact, and she does. So for cardiovascular, you're going to feel the radial pulses. You're going to feel them on both sides to make sure that they're equal. And radial pulses are 2+ and non-bounding. Put your feet down. You're going to check pedal pulses on both. Also over here, we're going to go ahead and check our other pulses. No edema present. Pulses are 2+ and equal. I'm going to check for capillary refill. Both of these are less than 3. Like I said, no swelling, no edema. Capillary refills are less than 3 throughout. Listen to the heart sounds. Also going to flip the stethoscope over and you're going to listen to the carotids. Make sure that there are no bruits. You're going to feel them one at a time. And again, those are 2+, you know, they're non-bounding. I don't feel any thrills. Okay. And then you would have to check for JVD. You would have them lay at a 45-degree angle and turn their neck to make sure that the jugular is not bounding. Heart rate, is normal, regular, no extra sounds, no murmurs noted. We'll go ahead and listen to respiratory while we're here. While we're doing that, we're going to assess the chest for, symmetry, make sure that there's no accessory muscles being used, she's not having any trouble breathing, no deformities and anything like that. Over here on the front, we can go ahead and, look at the belly. You're going to look at, the shape, the contour, and things like that just from the outside. You can go ahead and listen to vowel sounds in all 4 quadrants. Vowel sounds are present in all 4 quadrants. While I didn't hear any wheezing, no struggles breathing or anything from the front, everything looks symmetrical. You would look here from the side and then also the back, and you can look at the AP diameter, and everything looks to be fine. I'll go ahead and take a listen at the back. And then while you're back here, you can also test for CVA tenderness. Does that hurt at all? No. All right. So also, if you could sit right here. Yeah, you're good. Okay. Here's a little bit. So we're going to check as far as tactile fremitus. So you would just put your hands right here, have a patient cross their arms in the front a little bit and lean over just a smidge, and then you're going to have them say 99.
99.
Say it again.
99.
Perfect.
99.
One more time.
99.
Perfect. And then the vibration, is normal and equal all throughout. So the breath sounds, vowel sounds. Okay, and if you wouldn't mind to lay down right here, it's going to take a listen to your, we're going to listen for the aorta, the renal, iliac, and then the femoral artery. So when you're doing abdominal assessment, you want to make sure that the patient is covered. Make sure we cover everything. Then you have the femoral arteries. Everything is equal there. No abnormality. While you're here, you can check for any kind of ascites or anything. Also, you're going to check for the liver span. So you're going to percuss down through here where it changes. Then you're going to come back up this way. in here, and then you would measure between the two. Normal size of the liver is 6 to 12 centimeters. You would come over here on this side, and you would feel to see if you could feel the spleen. I don't feel the spleen at all. You can do percussion on the abdomen. And then you would do light palpation to see if there's any tenderness throughout. And then you would go in with deep palpation, which can be difficult if they're ticklish. Okay. And then for the splenomegaly, we check for the CBA. Ascites you can check here. You can also have the patient roll to their side. The ascites will, go down to the dependent side. You can also have them as you'll hold their belly, and then you can see if there's any type of waving and stuff when you percuss on the abdomen for ascites. We do have cardiovascular, we did that, neurological, all those. We do have, as far as the abdomen goes, you can check for, you can check to see if there is any pain on the right side when you're pushing on the left side. That is for the appendix. If they're going to have pain over on one side, if you push on the left side, and then they'll have, pain. The psoas sign is that you will raise the right leg and then, flex it and see if they have any pain on that affected side. And then arbitrator is when you take their leg and then you move it over, on this way. Let's see. And then to check for cholecystitis, you can press here on the liver and to ask them to take a deep breath and see if they have any pain while they're there. She does not. Let's see here. Okay, if you want to go ahead and set back up. We're almost finished, so we are going to check for light touch. We're going to check to make sure everything else is fine neurologically. If you can put your legs down, I'm going to raise your pant legs up. Get all my supplies, and you can close your eyes, and you can tell me when you can feel.
I can feel it.
Okay.
I can feel it. I can feel it.
Okay.
I can feel it.
Okay. And then you can take a sharper object, not super sharp, and then you can check, with that throughout.
I can feel it.
Let's see. So we will also check here. If you close your eyes, I'm going to move your toe. If you can tell me if it is up or down.
Up. Down.
Right.
Down. Up.
Perfect. And then you can also take the tuning fork. You can hit that, and then you can also take it and put it here, and then that checks for their vibration, and their interphalangeals. Let's see here. And then, excuse me. You can also, so you're going to check to make sure they're able to identify things. So if you can close your eyes and let me have a hand. Could you tell me what this is just by feeling it?
Those are keys.
Right. Then you can do it on the other side here.
It's a cotton ball.
Perfect. And then you're going to, can you tell me what number I'm drawing?
6.
Perfect, perfect. And then this one over here. It's a number.
It's
It goes straight down.
what?
Perfect, perfect. So if you, I'm going to have you close your eyes, and can you tell me where I'm pointing on your body?
My knee.
Perfect.
My hand.
Good, good,
My forearm.
good.
My other forearm.
Okay. And there's that. And then while we're here, we are going to check our reflexes. So you're going to check bilaterally with the reflex hammer. Perfect. Mhm. And then you'll hold your hand right here, like that, and then you would hit. Perfect. Try not to hit the patient. Let's see here, and then we did the biceps. We'll also, so if you could lay down one more time. I'm sorry we didn't do this before.
It's okay.
Okay, so if you flex your neck forward, do you have any pain anywhere? I don't see any flexion in the hips or anything. You can lay it back, and then we're going to, can you raise your leg up? Any pain in your head or anything?
No.
Okay, put it back down. Can you put your feet up, put them down? Any pain?
No.
Okay, and then you can sit back up. Sorry.
It's okay.
Can you take your hands and put like that? Perfect. And then for the weaning of the scapula, you would have them, put their arms up against, the wall and push, and then you would watch with that. You can also check the strength in their hands by grabbing both of my hands here. Grab, squeeze, grips are equal. You're gonna, don't let me push you. Yep. Try to pull me towards you. Yep. Good. And then do here, and we'll say, don't let me push you. Yep. Push towards me. There you go. Up, push towards, up, push towards. All right. Do you think we're done? Let me take a quick look here. Make sure we got everything. You do the apical and radial pulses. You would have somebody listening and feeling, you would do one and they would do the other, with the apical and the radial pulses to make sure, they're, in sync and they're good. All right. Thank you.